session.
I feel better.
Learned a lot.
I feel better knowing that I'm not alone.
Yeah.
So I just want to thank you all for coming to the support group today. I enjoyed all of your shares and I thank you for all sharing. Now I'm going to ask to do individual sessions with you all just to discuss patient education.
Okay, great. Thank you. So again, my name is Irini. I was diagnosed with myasthenia gravis 3 years ago, and it's really hard for me just feeling tired all the time, and I feel like I can't live my life the way I want to. Could you explain what's actually happening in my body making me feel this way?
Of course. So again, my name is Madeline. I'm the nurse. So basically MG is a rare autoimmune disorder that causes your skeletal muscles to become weak and tired very easily. Basically, the body produces antibodies that target certain receptors on the surface of muscle cells and affect the neuromuscular junction. The antibodies block the muscle signals to contract and lead to muscle cell destruction, and this could cause what makes you feel weak and tired.
Thank you.
Do you know why I have this condition? I'm a 21-year-old and I'm pretty healthy. I like to exercise, I eat really healthy, and I watch what I eat, and I go to the gym about 4 times a week.
So actually, MG most typically affects women ages 20 to 40, and for older men, it's between 50 to 70, but it can occur at any age, including childhood. This condition is caused by a problem with the signals between your nerves and muscles.
So by eating healthy and exercising, it won't prevent it?
Unfortunately, eating healthy and exercising can't prevent this from happening. It is an autoimmune condition where your immune system is mistakenly attacking your own body. The only known risk factors for this condition are having a history of autoimmune disorders in your family.
I'm just so tired of my muscles feeling tired all the time.
So in our next support group, we're actually going to talk about treatment and prevention and alleviation of symptoms.
Oh, that's perfect.
Yeah, so that'll be the topic of our next support group, so hopefully that'll help.
My name's Felicia, and my doctor diagnosed me with myasthenia gravis not too long ago. But what are some of the common symptoms? Because I don't really even know what happened to diagnose me with this.
Of course. So the first signs and symptoms of MG are usual double vision or drooping eyelid.
Oh, so that's why my eye felt so droopy.
It could be, yeah. There can also be weakness in the arm and leg muscles or difficulties with speaking and chewing. Any repetitive muscle movement can cause this feeling.
Now that I think of it, actually, I was chewing gum. Every time I chew gum, it hurts my muscle the longer I'm chewing it. So I don't even chew gum anymore because it just hurts too much.
Yeah, it's hard. It's the repetitive movements. For example, after eating a meal and using the muscles of your jaw, you become tired and need to take a little break, but then you're good to go.
Yeah, I would have never known I had this if my doctor hadn't caught it. I think I did.
However, the degree of weakness varies from person to person. Often people do not recognize these as symptoms of MG. One of the hallmark symptoms is having muscle weakness after some kind of activity, and then it improves after rest. So it's important to incorporate rest periods when you're planning on going to a park with your kid or something like that, where you need to incorporate rest time to alleviate your pain or any weird feelings in the muscles.
Okay, that sounds good.
Hi, so I'm Allie. I really enjoyed today's session, but I'm just really confused. There's nothing to prevent this from happening. I can't change anything in my everyday life.
Unfortunately, no, but we'll talk a little bit about this. So the main thing that you could do is keep your body healthy. So that'll provide more strength, which will help you overall with your symptoms of this condition. Having an even worse immune system won't help you in the long run. So trying to reduce stress and
Staying healthy.
Yeah, and avoiding any outside illnesses will also help with that. Some people with this condition have gotten their thymus surgically removed. They say it helps with the muscle weakness because the T helper cells, which originate in the thymus, help B cells to make antibodies to the acetylcholine receptor. So this is blocked on the surface of muscle cells in MG.
Hopefully it doesn't come to that, but I'll definitely start with exercising and eating healthy to prevent any other immune conditions.
I think that's a great plan.
Okay, thank you.
So how is this condition diagnosed? I'm really scared of getting my blood drawn and stuff.
Okay, we can talk about that a little bit. So to begin, your doctor reviews your symptoms and conducts a physical exam along with some tests. They may perform a neuro exam that tests your reflexes, your muscle strength, balance, coordination, and your muscle tone. They could also perform what is called the ice pack test. So when a patient comes in with a droopy eyelid, So they place a bag filled with ice on it, and after 2 minutes they observe for any signs of improvement. A blood analysis could also show abnormal amounts of antibodies that are blocking receptor sites from nerve impulses that tell your muscles to move. So in some cases, a blood test may be required, but you can always talk to your doctor and see if there's any other options instead of blood being drawn.
Okay, thank
You
you.
mentioned something about like an MRI. I didn't know if you could see it on an MRI.
Okay, yes, there are. You can have an MRI or a CT scan, I'm pretty sure, and that could identify a tumor or other problems with your thymus. There's also repetitive nerve stimulation where a doctor attaches electrodes over your muscles. So this will send small pulses of electricity through the electrodes to examine the nerve's ability to send this message to your muscle. So it's really just looking at the nerves in your body. And then to diagnose MG, doctors will test the nerves a few more times and see if the nerve's ability to transmit signals worsens with fatigue. So that's another way of diagnosing MG.
So is it kind of like an EKG? Like it's like
Yeah.
non-invasive, right?
Yeah, non-invasive, but it's looking at the electrodes throughout your body.
So how is our condition treated? Like, what do they do for us?
So there's various treatments, alone or in combination, which sometimes is proven to be a better way of treatment, and they can relieve symptoms of MG. Your treatment will depend on your age, how severe your disease is, and how fast it's progressing. As we talked about, removing the thymus has improved symptoms for patients with MG. But you can discuss with your doctor which options are best for you and what he or she recommends.
So I don't really want to take any like medications. Would that be a problem?
So there are non-pharmacological treatments that they have had studies that have shown improvement in symptoms. That includes healthy eating, exercise, stress management therapy, which you could also talk to your doctor about, being outdoors, and socialization in general. So being around people also helps.
Okay, that's
So like, what kind of medications are available for MG?
So there's actually two groups of medications that are used to treat MG. One is called anticholinesterase. This medication temporarily relieves the symptoms of MG.
Okay.
So these have the fewest long-term side effects. It's also the most rapid-acting medication available for MG. The most common med is Mestinon. I don't know if you've heard of that, yeah.
Is there any other meds besides those?
So that another medication group that's used are immunosuppressants.
Okay.
So these attack the disease at its source. So it suppresses the body's immune system, and they stop the body from damaging the neuromuscular junction in the first place. So it kind of cuts off that attack
So
in your
my muscles
body.
like won't be tired.
Yeah.
Okay.
Well, you can't guarantee that, but it'll
Alright.
definitely help a little bit.
Okay.
Prednisone significantly relieves MG symptoms for a large majority of those with MG.
Okay.
This drug is not as fast acting as the others, but it's faster than other immunosuppressants, and it's relatively inexpensive. So it resembles the natural hormones in your body, which helps with the fewer adverse side effects.
Okay, great. Thank you so much.
You're welcome.
Are there any special considerations that I should watch out for?
So for Mestinon, it can cause stomach cramps and diarrhea. So it helps to take them with bland food, like crackers, applesauce, or yogurt. Other common side effects include muscle twitching, muscle cramps, and sweatiness. Sometimes these symptoms appear when too much medication is taken.
Because sometimes I have like really bad headaches, so I take extra like ibuprofen or something, so I shouldn't take extra of this.
No, so always stick to what your doctor prescribes as a dose, because it can increase symptoms if you take too much.
So what about prednisone?
So while prednisone can be very effective in treating MG, it carries the risk of serious side effects. The severity depends on the dosage and length of time that medication is used. So this includes insomnia, mood changes, weight gain, fluid retention, reduced resistance to infection, increased susceptibility to diabetes, and much more. So it's very important to report any of those symptoms to your doctor and also talk to your doctor. Most of these side effects can be prevented or managed with other medications. It's important to eat healthy and follow a well-balanced diet to also alleviate some of those symptoms. This can help prevent bone thinning, reduce fluid retention, and minimize weight gain for starters. So eating healthy and exercising will always be a good option for when you're taking these medications.
And I'm already like on that. eating healthy and I exercise a bunch, so I feel like that'll be good for me.
Good, and we'll talk about that more in our next group. So at the end of all my support groups, I like to do a little teach back session. So I'm just gonna ask you to tell me what you feel you've learned about MG today.
Okay, so basically it's an autoimmune condition that affects women between 20 and 40 and men between 50 and 70 primarily, but it could affect anyone. And in the autoimmune condition, the muscle cell receptor is blocked off, causing them to be harmed, which is why I constantly feel tired. And I just, after any repetitive motion, I feel like I need rest. So I could treat this by taking care of my body, exercising and eating well. I could also treat it through medical interventions, and there's a surgery option, but ultimately it can't be cured, only treated. I also know, I think that's it.
That's awesome. You definitely understand MG a lot better now, and I feel like you've learned a lot. There's just one thing I wanted to add that is a nursing consideration that we like to explain to our patients. It's about chewing and swallowing. So if you ever have any difficulty with either chewing or swallowing, please don't be afraid to reach out to your doctor. They may want to refer you to a speech pathologist to assess if you might be an aspiration risk as your disease progresses, or prevention for that.
Okay,
All right, if you have any other questions, feel free to reach out.
Thanks so much.
You're welcome.